Okay, here we go.
Welcome to the River Park Dental Show. This is Dr. Phing Saurer with Chuck Norris, Mike Morris.
That was your new intro?
No, you look a little Chucky today, though.
First of all, I'll take it as a compliment because we all know Chuck Norris could whip anybody. But second of all, you got me all excited because I thought we were having a new intro to the show.
I
You said it in the green room, and then you're like, I'm ready to go, and now you chickened out.
I couldn't do it. I'm not exciting. I couldn't do it.
Well,
I'm not a risk taker.
But are you not excited? We haven't been able to do it because of the holiday and all that.
I know.
We're back together again.
How was your holiday?
It was fine. I just worked through it. I had to prepare for this show, which apparently you did not. No. No, it was fine. There was nothing really
Did you watch
exciting.
any fireworks?
I did, but I did from the safety.
Did you go to a parade?
What? That's
Did
outside.
You see, how many fireworks did you see?
I saw a good 5 minutes from my driveway, and that was good enough.
Look at you, the daredevil.
Well, yeah, I did walk out to almost the sidewalk, and then I said, "This is too far outside. I got to come back."
It's so loud. It's so loud.
Yeah, I was
dangerous.
I couldn't hear the music, but I could see the explosions.
Oh, well, I didn't hear the music. I was on the balcony of my office looking at the Dublin fireworks.
Oh, it must be
Pretty
nice
cool.
to have some fancy balcony
I know.
and some fancy office to watch fireworks from. Did you have other people there, or was it like VIP only?
Yeah, it was just me. I just went by myself.
Well, I never know with you. I never know if you're actually going to invite other people.
I didn't even let my kids come. No, it was
Good.
my kids and I, my husband and his mom, my mother-in-law.
And you shut everybody else out?
There was
Nice.
no one. No.
Now, you have employees.
I think they were all busy. They were all traveling. Or...
You didn't bother to ask them? It's okay that you didn't
It
bother
was
to ask them.
well, it was a last minute thing. I didn't even know that I was going to do it. I wasn't sure if I was in the mood.
You know,
because
I always say that when I'm
parade.
lying. It was a last minute thing, so that's good.
Like this show. It was the last minute.
Yeah, this is always a last minute thing. I mean, we do have a topic, and we'll get to it eventually, but I'm just now curious that you have this huge balcony,
Yeah.
and you just 5 people on it?
How many were there's 6.
Okay. So, just so you know, it's more about you than
Yeah,
these
so
other people.
if the Titanic's sinking, I'd take a boat for myself and my family, apparently.
I know you well enough at this point to know that. Before we get into today's topic, I do want to say, the last time we did a show, we were talking about some of the things you guys do differently in your office. I saw more dancing on the Instagram, on the Facebook.
There's so many dance videos. Which one are you?
I know, but these are new, and I guess my curiosity was, I know that these are planned.
Yeah.
And then, I know your big thing is when you see someone else doing it. I saw for National Ice Cream Day, I saw someone else doing almost your same dance. How do you feel about that? Do you think that's trademark infringement? That's kind of your gimmick. I don't know any other dental people who dance.
How many dental people do you know?
Like thousands. You
Do
forget
you?
at one time I was married to a hygienist. Now, that guy's not dancing that I know of. And their office doesn't seem as excitable as yours. I just want to point out, when I see other dental places dancing, I think of you immediately.
You know, I will say what I find interesting is that a lot of dental offices follow our page. I don't follow any dental practices.
Well, you don't know how to use social media. I think we discussed this.
But
You
I
don't
don't
know
see
that.
the point of following. Like, it's just...
I just thought it was odd that now I'm seeing there
You
are
see a lot
dance
of it,
crews
right?
being hired as hygienists, and I think you started a trend. That's all I wanted to point out.
Oh, okay.
All right, so we should get into some dentistry. I was just curious as to if you see that a lot in your practice. A lot of
What,
people just have to
dancing?
dance. It's going on a lot at your office. And then I saw some behind-the-scenes
Sometimes I'm
footage
not
of
ready,
videos.
though.
No,
Sometimes I'm...
you're not ready right now. All right, enough of that. I'm glad we got to catch up on the air.
Yeah.
But we had a topic come across that I thought, this is perfect for you because as much as you don't like to talk about dentistry, you do like to talk about dental emergencies because you like to get in there and you like to fix things, right?
I do like to fix things.
So this is all going to be about dental emergency. Try it again. Emergencies.
What's going on?
We can't even cut it because it's live. We can't cut it.
You didn't nail it.
So can we just start with some of the things that have come in as dental emergencies that we've seen in the past or people have submitted? And I'm just curious to get your take on them. We're going to start with the easy one.
Okay.
Okay, chipped tooth. How big a deal is that if somebody has that issue, whether it's they ate something, they bit into something, or they just got hit while they're horsing around?
It depends. It depends on how big the chip is. The answer's always going to be it depends.
I know this already. I guess the audience at this point would also know. It depends on every...
How big is a chip? Are you in a kind of pain? Is it like a front tooth or a back tooth?
You're asking me? I don't have the issue.
Okay,
so I'll give you the issue of it's a chipped tooth in the front.
Yeah.
So it's a cosmetic issue.
It doesn't hurt, though.
Okay, in this instance, it doesn't hurt. It's just a front chipped tooth.
Yeah, then we would just put a filling. It depends, though, on the chip, though. If it's small,
okay, what does it depend on? Does it depend on pain? Is it pain first, cosmetic second?
If there's pain, then it may need a root canal. But we don't do that necessarily right away, because sometimes if you have trauma, you will have pain. So that's not necessarily something you would do. Now, if you break the tooth and you have pulp exposure, the nerve of the tooth is exposed, then you would do a root canal. Sometimes if you have trauma and the tooth gets loose, we might put a splint on it and try to hopefully stabilize it, and then keep an eye on it, and then have you come back for follow-ups, and it may still need a root canal. So we just keep it on watch.
When you say trauma, you mean trauma to the root of the tooth?
Well, say you've got like a baseball thrown at your face.
Okay. That's very specific. That seems like that's something you've dealt with recently.
No, but there's a lot of sports injuries, so you should always wear your mouth guards. But if you do have a
even at work, if you're playing ball at night, wear that mouth guard during the day.
Yes, because at my office, someone's always throwing a baseball at my face.
Someone's always moving around at your office. I figured that you're passing out mouth guards.
Well, I'm always nervous. One of my biggest fears is when I'm holding my son, who's 2, and he likes to jerk his head back and like right into my face. I'm always like worried that I'm gonna lose a tooth.
How do you avoid? I actually worked with a guy that lost a tooth that way.
Yeah,
he was holding his son.
I've had more of that than not. Like moms coming in because their baby knocked their head against their face.
So are you saying that you can treat it after or don't have babies? Is what I was gonna say. Don't have children. So when the biggest issue is the trauma that it's the pain you can feel, and then the trauma afterwards that you have to deal with.
Right.
If the trauma is basically in the root, I mean, that's something you have to look at over the course of time, right?
Yes.
Because you have to see what develops.
Right.
If it's just chipping of the actual tooth, you can deal with it because it's cosmetic.
Yeah. If it's just a small chip, like the corner of the tooth, then it's cosmetic, and we can either, depending on the size of the tooth or the chip, we can just put a filling in, or it would need a veneer or a crown. But if there's trauma to the root, it may need a root canal. It depends. If the nerve is exposed, then you would need a root canal. Now, if you actually lose the tooth, it comes out of your mouth, like the whole root. They do recommend, or we recommend that you try to put it in as quickly as you can, and get to
into your mouth.
Put it back into the socket if you can bear it.
Okay.
Make it clean.
So I've always heard you could put it in milk or something and then bring it in that way.
Yeah, you want to keep it.
That's a real thing.
Yeah, I've heard so many different things. People put it in milk. If it's a sports injury and they're out, there's a lot of Gatorade, so they'll put it in a Gatorade for electrolytes.
Which is bad for your teeth anyway.
Well, we rinse it off with saline, though.
I know, I'm just pointing out we don't drink too much Gatorade is what we're saying. Yeah. A lot of sugar in there.
I know.
Eats away the enamel.
Yes. Especially with mouth guards. Then it just soaks.
Oh, that thing's gotta be like it just...
super acidic.
Yeah. Okay, so if you can jam that tooth back in.
If you can do it. If not, try to get to a dentist, and then we will put it back in with anesthetic, of course.
Hold up. Are you saying put that tooth back in and just see if it see if it just stays on its own, or put it back in and then you got to get right to...
You still want to see a dentist.
All right, well, I just want to put that little disclaimer in, like, don't just try to jam it in and leave it.
No.
Okay. Well, you got to be specific. It depends. It depends.
It depends, yeah. But if you're young, the likelihood of it surviving or doing well is good. When you get older, it's a little bit harder for it to work out. In that case, if you lose a tooth, then we can replace it with an implant.
If it gets, I wanted to ask about veneers. If somebody gets a chipped tooth, are they more of a candidate for veneers? Because that's more of a cosmetic look than it is about function, right?
Yeah, but I don't know what I'm thinking about. So, like, if it's It depends on the size of the chip.
I
and
knew you
where
were
it
going to
is.
say depends. I knew it. What I mean
I'd have to
is-
look at it.
I get it, but I'm saying most people look at the front of their mouth, right?
Yeah.
Everybody, if you have a crooked smile, you have a chipped tooth, you typically don't want to smile really big.
Yeah.
So a lot of people elect to get veneers if they have that chip. Is it one
If
of
they
the
have
things?
the chip or their teeth are slightly uneven and they don't want to do braces, or it's really discolored, there's a lot of different reasons why people want veneers.
Right,
But it is cosmetic.
in the chipped tooth scenario, let's stay here. Let's stay in this ballpark.
I want to keep on going.
I know you want to go to the next thing. I'm curious. So you have this chipped tooth situation. Someone comes and said they'd rather just get the veneer. The veneer is more expensive, but it's pretty much permanent, right?
It's a long-term fix.
Okay.
Nothing's permanent. So.
It's like you water down every argument. Every time I'm like, this will work for you, but not all the time.
Well, no, like crowns, you have to get them replaced over
All right.
time.
Can we do it
It's
like
not
a
long-
washing
it's not
machine? You get a
permanent.
10-year warranty on a veneer for the most part. Can we at least say that?
Yeah, 5 to 15 years.
Okay, we'll say 5 to 15 years. You won't even meet me in the middle. Okay. The next one is sensitivity, which you said you have. Gum sensitivity for hot and cold.
Recession, yeah.
Yeah. But recession is
When the
different
gum-
than just... I know what it is. Recession is different, though, isn't it, than just hot and cold sensitivity?
Yes.
You can have both.
Yeah, so it's the severity of the sensitivity. So mine, I think, I mean, it hurts when I eat cold or hot. But if it's a hot tooth, whatever they're doing, it just flares up and they have a...
What does that mean exactly? I think we've talked about it before, but I heard the term hot tooth.
When there's a lot of inflammation going on in that tooth and the nerve is really inflamed and you have severe pain.
I just remember that was I think it was in a movie where like somebody they said I got a hot tooth and that's why I had to drink all this whiskey. That's not a remedy, right? For hot
no.
tooth? Just curious. Like that's a real term.
Yeah,
Okay, I didn't know that.
I see it all the time.
But
In any kind of sentence.
That's right, it was on Mad Men. Thank you, Rachel. He had a hot tooth and he was drinking every brown form of liquid he could.
Did it help him?
No, eventually I think he had to get that tooth pulled.
Well,
I mean, we should watch that show and break that down. Just the dental episode of Mad Men. But I think it would be instrumental. But yeah, he had a hot tooth and he was drinking bourbon or something during the day. That doesn't make it go away, right?
it can numb it.
But you'd have to wake up and do it again tomorrow.
Yeah, I mean, it doesn't take care of the infection. or
Well,
the
I wasn't
nerve.
suggesting that as a doctor. So if you got a hot tooth, go to the dentist.
Yeah.
If you don't have a good dentist, whiskey. It depends. It depends.
Or vodka.
Yeah.
Depends on where you live.
Right. If you're one of the, what did we say, the 50 states?
one
The
was the
worst one was
worst?
like West Virginia. It was in
No, it was like Louisiana, right?
Oh, yeah.
Alabama.
Alabama. Yeah. If you're in Alabama, I just told you how to fix that.
Yeah.
Arkansas the same. Jim rang in with that one. So before we go to break, I want to get into throbbing pain. Is throbbing pain, that is more of a gum or root issue than it is a tooth?
It could be both. It
Say
depends.
It depends. It depends. But when somebody says they have
There's
throbbing...
no finite answer to any of these questions.
Don't feel pressured. This is only your radio show, so you don't know the answer. I'm just curious, when people have throbbing pain, is that an indication of disease? I know you're gonna say it depends.
It could be infection. It could be a tooth that needs a root canal. It could be that you're grinding or clenching your teeth too much, and then you're putting a lot of force and pressure on it, and it just throbs. It could be a TMJ issue. It could be gums. If you have an infection in the gums, your tooth could feel like it's throbbing. It could be a sinus infection. If you have a sinus infection and there's inflammation around the roots of your teeth, then you could feel like there's just a lot of pressure and throbbing.
But can you, as a dentist, identify that? Can you, or does a patient have to tell you what's going on? Because it is their mouth or their head, neck, and
Sometimes
throat.
they can't tell. So, like, once you have a toothache, sometimes it starts to feel like it spreads, and then you just say, well, it's just in this area. So we have different tests that we use to try to identify which tooth is causing that pain. In addition,
How do you test that?
well, first thing is we take x-rays and we look at the roots of the tooth. The other thing is we do cold and hot tests, where we just put cold on the tooth, and if it reacts to any kind of cold temperature, basically.
Do you mean that they
in an
can feel
abnormal
it,
way.
or there's a
Where
discoloration
there's
or
like,
something?
well, no, where they actually feel pain when I put spray cold air on it. And then we do percussion tests where we tap lightly on the tooth, and then they have sensitivity from there.
That's a lot of tests going on.
Yeah.
All for hot tooth.
Well, you have to identify the right tooth. Don't want to work on the wrong tooth.
I've seen many a story where someone got sued for working on the wrong body part.
Part, not a tooth.
Okay, well, apparently you didn't read the article. I wasn't saying it was dental. I was just saying it's happened. Before we, because we're running up against a break, and I really got a very exciting thing that has to do with throbbing pain. All right, we're going to go a little overtime, then we'll take the break. So, swelling of the gums leading to neck and, what was it saying? Chest issues. So, there's a swelling in their mouth, and they're having issues with their neck, right? Are they one and the same? Like, in one lead
Oh, there's
farther?
like drainage and there's cellulitis. Yeah.
That's the way I was going to say it, cellulitis. Yeah, if you're having that issue, that is directly caused from your mouth, right? It's coming from your gums.
And it can be very dangerous, especially if it starts to impinge on your airway. So if it's,
Have you seen that? Like, have you had to deal with that before?
I have not personally, but it can be very dangerous because that bacteria.
But you're prepared. If somebody said, I've got impingement, you can handle it?
I don't know if that's what they say, but yes.
They would say that because they wouldn't know the
That's
technical
what
term.
you would say.
That's what I would say. I would say I have an impingement. Can you deal with it? I'm asking you on the air. If somebody calls with an impingement, will you deal with it?
If you cannot breathe, you really should call 911.
Well, you've heard it here first. We're going to go to break. That you won't deal with someone if they have an impingement. You're listening to the River Park Dental Show.
If you cannot breathe, you would not be calling me first.
I would text you. I would still communicate. I would send you an email, and I would hope you
I'm
would check
turning
it.
blue. Is this normal?
She would be saying, call 911, you idiot.
I would send you a DM on MySpace and say, my throat hurts. Please help me. What's the big deal?
Hurting.
It was hurting.
Does it hurt because of the
Have you had an impingement?
anorexia?
I might have had an impingement.
Have you ever had a chipped tooth?
No.
I have. These
In
two.
the front?
When I was about 12 years old.
Both of them?
Yeah.
But did
It
you...
was like an upside down V.
Oh.
Like a
I chipped
vampire.
part of, because I
Wait,
was
upside down
riding, I had my head down, I was riding my bicycle, pedaling like mad at full speed, because it was winter, it was early December, and it was cold wind, I was going right into the wind, boom, right into a parked car. Probably the funniest thing I ever saw. Yes, I can laugh about it now.
Yikes.
And then my dentist, after like a week and a half, he got in to see, said, are you in pain? The dentist was a dear family friend, we called him at home. He said, are you in pain? No, not really. This is after a few hours. And he said, okay, come in and see me about a week and a half. And he put a little falsies or whatever he put in here.
Well, then
and
of
my
course it's not a
dentist over the
veneer,
last
right?
10 years keeps telling me, hey, you ever want to get that fixed? I said, yeah, that'll cost me money. I don't care if it maybe, people look at me real close and they, oh, I can tell there's a little bit of a, it looks a little gray or it looks a little bit off color. I don't really care.
If you were wearing a mouth guard to your dental office...
No, if I was wearing a mouth guard when I was pedaling my bike,
Always wear a mouth
probably
guard.
had a concussion, mild concussion
Always,
too.
no matter what. Even in your,
I'm going to wear a
dinner.
mouth guard the next time we do this show.
But after that, I did not ride my bicycle with my head down anymore. I learned
So
my lesson.
we all learned something today.
Yeah.
Don't
my
ride
lesson.
in the winter.
You should open
against
your
the
eyes when you're
And people
riding
on
your
Facebook
bike.
right now are watching, and they're going, "Who's that voice in the background? That idiot who rides his bicycle right into a
His
parked
name is
car?
Dale
What a
Earnhardt
moron."
Jr.
His name is Johnny Boy,
Yeah. Juan.
Hawani Boy,
All right. Are you ready to bring us back?
with the new intro.
No. Yeah.
No, I'll ask you the question. now.
Call Ellen and ask her what to say.
Yeah.
We're ready?
Yes.
Okay, here we go.
Welcome back to the River Park Dental Show.
Ping, we were talking about dental emergencies today, and as always, your quote is, depends. Depends. So these are all hypothetical things that have been emailed to me, compiled, so that I could ask you these questions.
Yeah.
So we can just skip that. You don't have to say depends anymore.
Well, I mean, I say that because that's why we don't diagnose over the phone. I know a lot of patients will call in and say, what can you do? But you have to see the situation. Everyone is different. We like to have customized care.
So when someone calls you, do you just divert back to, well, we have to see you to do it? What's like the oddest thing that someone's asked you to diagnose over the phone?
I don't know. Ellen
Impingement?
answers the phone.
I want you this week to find out what the strangest call you've had since the doors have opened What's the strangest call?
I
won't
mean,
name
I'm
the person.
sure in the past 10 years that she's been doing this, she's had a lot of different
I know, but
phone
there's
calls.
got to be somebody that called in with something that's just so offbeat.
Yeah, I'm sure. I'll ask her.
Okay.
Yeah.
Maybe make a video of it. So we're talking about dental emergencies and how you would diagnose and treat them. One of these that came across was loss of dental restoration. I think that means...
You lose a filling.
Yeah.
Or a crown.
Well, when they lose that...
Or anything.
Yeah, depends. So they could lose one of these things. You're going to know, right? Like, you're going to feel when that comes off. Isn't that how they first identify it's come out?
Yeah, sometimes they'll say, like, they noticed when they were eating, something hard came out, and then they had a lot of sensitivity with the tooth. Or, you know, they bit into something and they heard a crack, and then...
Always good. Always
it's
good
always
when
a
you hear
great
it.
sign
Yeah.
when you hear a crack.
So,
If you hear a crunch...
well, how does that work if you've done that? Like, there's a certain amount of time where you say you can't eat or drink until this is kind of taken its... You can't just leave an office having your cavity filled and then go eat, right? Don't
You
you,
can-
you
yeah.
have to let it sit.
What, with anesthetic?
No, I just mean, like, if you just filled that thing, how long does it take for that to
No,
set?
well, we
in it?
use the white filling, so you don't have to wait.
Oh,
You can eat right away.
I did not know that.
Yeah.
You're very
And then if we
fancy.
do the fillings with a Solea, you're not even numb. So then you don't even have to worry about chewing on your tongue or
I feel
cheek.
like that's like you just won the game. How do you squeeze Solea into the show? And once again, this is about 20 straight shows of Solea. So if someone does have that issue, how long does it take to kind of get back in to get that filled? I mean, is it an emergency to get a crown or a filling done right away?
I mean, I would say you should get it filled right away, just because if you leave it too long and you get food trapped there or bacteria trapped there, it can cause a bigger cavity issues, pain. So
Work
once
its way into your gums, then your neck, then your chest?
Yeah.
Just asking. Okay.
Cause impingement or whatever you want to call it.
I think that's big. I think that's what you said earlier, and I want to stick with impingement. I like it. So then there's the accident-related dental emergencies. Those are there people that are on call for that kind of thing? Like, you've been in a car accident or you've been, hurt playing ball, like you said, some kid gets hurt. How does somebody make plans to get emergency dental work done? Like, if you're their dentist of choice, how do they
And
get
it
a hold of
happens
you?
at night, or
Yeah, let's say it happens at 5, 6 o'clock at night. You're probably gone by that point.
yeah.
So, like, an emergency number?
They do. We have a number that they can call. It's really just our number, our phone number or our email, and we'll get back to you right away. If it's really late, I can call in a prescription to keep you comfortable. But I just saw an ER doctor that says he sees a lot of dental patients come in with emergencies.
With their teeth and Gatorade?
No, well, it's just that they wait so long that they have these huge abscesses or infections, and they are in so much pain that they refuse to go see the dentist.
So they make it worse by waiting.
By waiting, yeah.
Have you seen anything like that where somebody said, I put this off for like a year and it's just become, now here's all the damage, can you fix it?
Yeah, you see that, but you just go ahead and fix it. Give them all their options, whether it's whether it is a root canal, whether it's if it's too extreme and you have to extract it, or if you have to replace it because it's extracted with an implant. I give them all the options.
Do some of these options include like multiple visits? Because you can't do everything at one time, correct? I mean, some of it you've got to...
I like to do everything same day if I can.
Okay.
So if you're in pain, like, I'm not gonna tell you to come back next week, unless it's very severe and swollen. I might give you antibiotics first to kind of control the same day, and especially with if it's interior. We talked about front teeth. I've had some patients who basically broken off the tooth at the gum line, so it looks like the tooth is completely gone, but the root's still intact. In those cases, then what's nice, I can extract it that same day. I won't refer you out to an oral surgeon, and then if the bone quality looks good, then I like to place an implant immediately. And then you generally leave. Now, that procedure is a little bit longer, it's an emergency, but you can leave the office with a tooth. So people won't even know that you lost a tooth.
But that's something you have to have a conversation with the person. You have to let them know, this is what I suggest.
Yeah.
Right? Because then if they don't choose to do that, you have to extract a tooth because of pain. your teeth are going to start shifting over time, right? Because that is trying to fill that gap.
With the extraction?
Yeah. So you need something there anyway.
Yeah, so you can either do, that was extreme. So if I take a tooth out and place an implant in a crown, I could do that all the same day, but that's more of an extreme case. In some cases, people just want the extraction, but then actually recently I did an extraction, and what I did was I cut the root of the tooth off and splinted their actual tooth to their other teeth to kind of hold it in place. And it's for aesthetics too, until we can get them a partial denture. But they had to heal a little bit.
When you do, sorry, I got stuck on thinking what you just said. When you're doing a partial denture, that's still done in your office, right? It's all in one.
Yeah.
Like you can do everything in the same place. They don't have to leave and go see an oral surgeon here.
No.
Or no? Okay.
No. With a removable denture, it is a little bit more of a process because once you extract, I like to wait at least 2 weeks for the tissue and things to heal up a little bit so that we can make a partial that fits a little bit better. Because if you just did an extraction, the tissue's a little bit more raw. It's rough.
Impinged. I get it. We only have like a couple minutes left, but we only have a couple questions, so we're just going to pick the best.
Okay.
All right, ready? Well, one of these I think you kind of answered. What tests do you use to figure out these problems?
Pass, we already answered.
Right. Well, I'm going to check mark. So, you kind of talked about this. What happens if you don't seek treatment? Like, how bad could it be if you did? If you've got a dental issue, if you're having pain, not just sensitivity, but pain, the longer you prolong it, it's
if
not...
If you're having pain, it's probably reached the point where you're gonna need more work done on it. So the best thing is to come in and get your cleanings done every 6 months. Ours is an hour for each appointment. And that way it could be more preventative so that if we see something small that's developing, we can take care of it right away instead of waiting 5 years, 10 years, and then having it develop into something that needs a root canal or an extraction or an implant.
When you said an hour, is it an hour every time they're coming? Or is it just your first? So
for the first appointment, if you're a brand new patient, it's an hour and a half because we like to do a full assessment. And then after that, because we have all your history or your data, then we just kind of follow up, and every 6 months it's an hour. And that includes the cleaning, the oral cancer screening. You may or may not need x-rays at that time. Those are once a year. And then we just kind of look around and make sure everything looks nice and healthy.
And if they wanted to make those arrangements, how would they get a hold of you to make that appointment? So
you can either go on our website, riverparkdental.com. You can email info@riverparkdental.com, or you can call us at 614-689-8686. I remembered it.
Yeah. And if they get in now, maybe they could get in on that 4th of July celebration next year on that big patio?
Oh, well, that's the other thing. So if you become a new patient in the month of July at River Park, we are giving out these welcome gifts, which is a $50 gift card to Basso, that rooftop bar, and then also to Pins Mechanical.
That changed because it was the Ram before. Is the Ram still kind of in rotation?
We changed promotions. And then we also, for our current patients, if you refer patients to us, we also have a referral program as well. So you benefit from referring your friends and family to us.
And things are going well. We talked about in the hallway. Things are going well.
Yeah.
Do you have anything else? Any sage words of advice, impingement, anything else you want to throw out before we leave for the week?
No, I don't.
Yeah. Oh, yeah. Salea.
Get
Salea out there.
Just gonna say it.
We should just do a whole show where every third word is Salea. But that is something your office does offer.
Yes.
Right. All right. Well, I think that's going to wrap it up for this week. And again, if anybody wants to hear any of this show about dental emergencies, they can hear them on your website as well, I think.
Website and our YouTube channel.
Right.
I think. And I'm not sure if there's any.
I'm sure we'll add it. By the time we come around next week, we'll add something else.
It's everywhere.
Yeah. That's going to be it. And again, thank you for that brand new opening you did of the show. Why don't you take us out for the week with your brand new clothes?
Thank you for listening to the River Park Dental Show. One day I'll do a really good intro.
I was really RiverParkDental.com.
I thought you wrote